helping make your life easier. Moms every day.
The first time your child gets an infection, they might be treated with an antibiotic like penicillin. And what happens if they get a rash? So I'm here today with Dr. Susan Pay. She is with Allergy, Asthma and Immunology Associates here in Lincoln. And we're going to talk about penicillin and that allergy. Nice to see you, doctor.
Hi, good morning, Tara. Thank you for having me today.
So how do you really know, doctor, if your child is allergic to penicillin?
Many people actually report a history of penicillin allergy, up to 10% of our population. But in reality, only 1 out of those 10 truly have a penicillin allergy. So it really comes down to only about 1%. And the way that we like to really determine if there's a true penicillin allergy is looking at the clinical history of the reaction of what happened, and then actually doing something called a penicillin skin test to determine if that penicillin allergy is real or not.
How difficult is that test? And is it painful? Should someone be worried about getting a penicillin allergy test?
Right. So that those are excellent questions. And what we like to let our patients know as allergists is that this is actually a very simple test to do. We have the patient come into the office and we do what's called a skin test, where we put extracts of penicillin on their skin, and then we do a little scratch on the skin to introduce it to the immune system and look for a reaction. If they are allergic to it and there's a reaction, then we stop and we confirm that they have an allergy. If they don't, we do another step where we do what's called a dose challenge in the office to make sure 100% that they are safe to take it. So it takes a little bit of time to do the test, but well worth it to determine if it's real or not.
So a person shouldn't be worried about doing this test.
They should not be. And we, as allergists, really push to have people who report a penicillin allergy be tested and to delabel them, or actually take this label away from them, so it opens the door to allow the use of this antibiotic in the future, because it's still the best antibiotic for many infections. And many of their other providers, their primary care, their frontline doctors, would like to have this available to use to really target that infection and clear it.
Is it possible to outgrow a penicillin allergy?
It is, it actually is. So when we look at studies of patients who report penicillin allergy, 80% of those who really do have penicillin allergy after 1 or 2 decades, 10 to 20 years, most of them will lose that penicillin allergy, or we say outgrow it over time. So we really encourage them to be tested to clear this.
Really good information today for a lot of families out there. Dr. Pay, thank you for that.
Thank you so much.
And for more information on Allergy, Asthma, and Immunology Associates, you can visit 1011now.com/momseveryday/